This is how you would use Crystal. When you log in into the program, you just click on your name and hit OK. When the patient is signed in, you will see their name up at the top. The P stands for patient, B is for billing, R is for record. We will go ahead and go into their record. This is the template for Crystal that I have created. If you look everything, this is all, the first page is all the medical history on here. And I'm going to go through this. The front desk will go ahead and hit an establish button or a new patient button. If I hit the new patient exam, all the template will put everything as normal. As you can see here, it just pre-populated everything down the medical history as normal. If you notice at the top right here on file, it is green. If you click on that, you can see the patient's intake form. So I like to move this to the side. And let's say if I'm going through the medical history, I can tell the patient has asthma, they're taking albuterol, and there's some family history of grandparents with cataract, macular degeneration, diabetes, high blood pressure, and heart disease. If I go down, they have a little bit of allergies and asthma. So what I like to do is I like to go on here and make the changes. If I add the medication, I'm going to say the patient is taking albuterol. Double click the medication and it will be pre-populated right there. Since I made some changes right here, I would like to just update my medication so it can show up right here. Anything that's on the summary page will be added onto a Word document in case we need to send the medical records out. On here, there was some family history of grandparents. And then if you hit the X, it will clear it out and I'll hit allergies. And if I go down a little bit more, they had asthma. Sometimes there are patients that fill out the patient online and there won't be any document or intake form. And this will be filled out. If any of these check mark or if any of the boxes are checked, go ahead and just put it on here because anything that's in the blue area is what gets pre-populated to the next eye exam. Since my office gets a lot of audits, I would like 4 HPI for each patient. Let's say the patient came in and said they had no vision changes, no complaint. I'll go ahead and click the no vision change right here. But I would like to have something written. So sometimes the patient will complain that they're having some blurry vision. Both eyes are blurry for the past month. It's just been a mild change and they wear glasses and contact lens. And right now they are low on contact lens and need some more. Then the next page will be the refraction page. Everything got pre-populated as normal. The front desk will do the eye care and the auto refraction will be here for you. Please do all the pre-testing and please do the entering VA so I know what they're seeing. I do get a lot of audits, so the fill-in doctors, I've been getting dinged that they're not entering this in. So please do entering VAs for me. Then let's say that I do the refraction and I put in their prescription and I would like to finalize that prescription. If I don't hit finalize, if I go to the prescription page, there's nothing there. If I hit refraction and hit finalize, now if I go to the prescription page, the prescription is right there. If I would like to print the prescription, I can hit print the prescription and I would like to print the glasses prescription. I hit OK. My signature is on the prescription page and I hit print. Now going back to the refraction page, everything is filled out. I would like to know what they do or if they're a student and how they use their eyes. Another thing I would like to see is if I want to see any of the old prescription, I can hit the RX right here for the prescription history, and it'll tell me what the past prescription has been and which doctor has seen them. If I go to the next tab for the exam, the anterior say is pre-populated, but the posterior is not. So I would like to hit normal and I just make the changes there. Let's say that the CD is 2.5, there you go, or if one eye is just a little bit bigger. Now I want the right eye to match the left eye. I click this middle button and it comes over. And let's say that the patient has a little bit of cataracts going on. And I'll say it's in both eyes. So I like to make the changes right here. And then if I take a look in the back of the eye, I can hit normal and everything's pre-populated there for you. Or if they were here, if you know that they were established patient, you can hit previous and everything gets pre-populated from the last eye exam. If you do a visual field screening, you can click this button and it'll say everything is normal. If you did photos, you can click this button and it will pre-populate for you. If you need to write a medication, there are prescription pads in the drawers, or you can call the pharmacy to fill the prescription for you. Now, please do diabetic exam on separate days. I do not like to have it done on the same day as the vision exam since we need to bill the medical insurance for the diabetic exam. Let's say that they did come back for a diabetic exam and you just click this button and it will enter all the different that we looked at for no diabetes in the back of the eye. Now here is the contact lens tab. I would like to write in a couple things like if they're established patient or they're like not happy with dailies. Oops. And they want 2 weeks. Then if you click any of these buttons, it will go onto the trials. So let's say I like to try the AccuView Oasis, and I gave the patient a -1, and now they're seeing 20/20, and it has been a good fit. So now I would like to finalize. It's a 2-week contact lens, and I like to finalize that prescription. Now, if I hit the prescription, you can see that it has the glasses and it has the contact lens on here. And if I hit the prescription, I can say I want the glasses and the contact lens. And if you look down here, at the top is the glasses and the bottom is the contact lens prescription with my signature. Please do not change any of the expiration date because it is pre-populated with the dates on there. Now let's say that the patient wants to do monovision or something. Let's say if I did a +1. I'll say both eyes for distance are seeing 20/20 and both eyes at near they're seeing 20/20 and everything's good and they would like this prescription as a backup for prescription number 2. And now I have it as prescription number 1 and a prescription number 2. And then I'll finalize that. The next tab is a prescription so that you can see there's a prescription 1 and there's a prescription 2. And now you're done with the exam. And let's go ahead and just say that they're myopia in both eyes. We give them glasses and contact lens. Here's a contact lens sphere contact lens fitting, or we did a toric, multifocal monovision. So I'll click that one since we did a monovision on the patient. We also did visual field screening and we did photos for the patient. So please click on all these buttons so that the front desk can check the patient out. But I'll hit billing on here. And yes, I would like to do a routing slip. It's going to show what we did, which is a new patient. We did the refraction, we did the contact lens, visual field, and photos. And we want to assign the insurance to regions. And we just want to say everything is linked to myopia. And just double click that to get those check marks. You want to save the invoice. We do want a recall date, so we'll just say, okay, the patient is signed in. Do you want to sign them out? And we just hit okay. And now you are done with the chart. That is how you use MyCrystal. If you have any questions, give me a call.